Assalamu alaikum. Thank you. Thank you very much for the kind invitation. I am very happy to be here and to see how EASL and SALT have managed to build this meeting, this collaboration. I think working together is one of the most important things in our life, not only in science, in everything. My task is to talk about Best of EASL Congress in viral hepatitis, and I am going to focus on viral hepatitis B treatment because it's the most exciting and urgent need in hepatitis B. Despite the ability of safe and effective vaccines and treatments for more than 4 decades, there is still a large number of people living with hepatitis B. The majority of them remain undiagnosed, and very, very few are receiving treatment. And I can tell you that every minute, 2 people die from HBV infection worldwide. With the current treatment, nucleoside analogs, we can suppress viral replication, decrease the risk of cirrhosis, HCC, and liver-related death, but we cannot cure the disease. The rate of HBs antigen loss after 10 years of treatment is between 3 to 5%, clearly suboptimal. And we know that it's really important HBs antigen seroclearance, because this is associated with a reduced risk of hepatocellular carcinoma. We can see that our patients with complete viral suppression still are at risk of HCC, and HBs antigen seroclearance is associated with minimal risk of hepatocellular carcinoma. So how to increase HBs antigen loss? The only way is looking to new drugs. New drugs that, in general, target 3 different mechanisms. One is inhibition of viral replication. The second way is producing antigen reduction, or with a stimulation of the immune system. At this moment, there are more than 50 drugs under investigation. I am not going to talk about this large number of drugs. I am going to focus on those that in a more advanced stage of, or from my point of view, are or could be the most important in the future. Let's start with the drugs that increase inhibition of viral replication. And these were the first drug in clinical trials almost 10 years ago that are the capsid assembly modulators. We know that with the first generation of these drugs, that are oral drugs, safe, very well tolerated, we can decrease viral replication but not achieve HBs antigen reduction. And given in monotherapy, they are associated with a risk of resistance. What is new at EASL this year is this new compound, a new capsid inhibitor that is from Aligos. This is an oral drug, and in this study, this drug was compared associated with entecavir against entecavir alone. Patients with chronic hepatitis B were included, and what is important in this study is that the drug, the new compound, is more potent suppressing viral replication than the current treatment, entecavir alone. And it is associated with changes in HBs antigen levels. So it seems for first time we have a new compound, very well tolerated, that achieve a profound suppression of viral replication, and perhaps in the future, this new second generation of capsid inhibitors can replace the current treatment, the nucleoside analogs. The second type of approach is to produce a reduction in the production of antigens, particularly HBs antigen. And the way of the drugs that can do this are the small interference RNA and the antisense oligonucleotides. We know that with the first generation of these drugs, there is a dramatic decline in HBs antigen levels, but HBs antigen loss with SINRA is not achieved. So we have now more data with SINRA that are conjugated small interference RNA. This is a drug that is given subcutaneous. It requires an injection every 4 weeks. And the new data that we have is to combine SINRA, elebsiran, 2 different doses with PEG interferon, and in this study, these 2 different doses of the combination treatment was compared with pegylated interferon in patients with chronic hepatitis B. And this drug, this combination, was given for 48 weeks. And I think it's important to highlight that the patients included in this study have baseline HBs antigen levels below 3,000. This is an important thing for the development of new drugs, and the endpoint of this study was HBs antigen loss. These are the results. The results are impressive because we can see that the combination of different doses of SINRA plus PEG interferon are associated with HBs antigen loss in an important proportion of patients at the end of treatment, 26, 33%, much higher than monotherapy with PEG interferon, and at the end of follow-up, that means 1 year without treatment, we can see 21% HBs antigen loss, in contrast only 6% with pegylated interferon. So this is a promising compound because achieve HBs antigen loss, and not only HBs antigen loss, also the development of anti-HBs antibodies. The safety profile is similar to interferon, and I think after these results, we are going to have more results with this compound. Another way is to combine SINRA with an immune stimulator, with a vaccine. And in the same study that I presented before, there is an additional cohort, the cohort 4, that patients receive prior of this treatment a vaccine called BR2179 during 1 year, and then they started treatment with the combination of elebsiran and PEG interferon. And we can see that during this previous period with the vaccine, there is a stimulation of different interferon gamma genes, and after, when these patients started the combination therapy, they experienced a faster HBs antigen decline and clearance than those without the previous treatment with the vaccine, showing that the vaccine induced a CD4 T cell response and high rates of anti-HBs seroconversion. And this probably could be another good candidate for combinations in the future. But probably the most attractive drugs currently are antisense oligonucleotides. Antisense oligonucleotides are only an ASO. It needs to be given every week as subcutaneous, and it acts at the cytoplasma and the nucleus of infected hepatocytes. And these are new data with a new ASO. It's a more potent antisense oligonucleotide, and in this study, this patient received for 24 weeks this new compound with a nucleoside analog, and the results were compared with another arm without treatment, and they started 8 weeks later, the antisense oligonucleotide. Again, here the entry criteria is that patients have chronic hepatitis B and HBs antigen levels below 3,000. And we can see in the study at the end of treatment, a high proportion of patients, 75%, achieve HBs antigen loss. And these probably are the most highest and impressive HBs antigen loss with a new compound. In addition to this, the study shows that the patients who lost HBs antigen develop antibodies at the end of treatment, so very, very fast. And there is a relation between HBs antigen decline and ALT elevations. That means that patients that have ALT elevations achieve the maximum decline in HBs antigen levels. The safety of this compound is very good. There is no important side effect. The only thing is ALT elevations, but these ALT elevations with this compound are good because are associated with HBs antigen loss and seroconversion. What is important to know in this study is what will happen when treatment is stopped. And if this HBs antigen loss is persistent, is maintained off treatment, or there are some relapses. And I would like to finish with bepirovirsen. Bepirovirsen, it's the first drug that has demonstrated in a phase 2 study the possibility of functional cure of HBs antigen loss. And in this study, we have learned that patients with low levels of HBs antigen below 3,000, 24% of them at the end of 24 weeks of treatment lost HBs antigen. Some of them off treatment relapse, and the response is maintained in half of them. At EASL, new results were presented showing that the patients who lost HBs antigen maintained the response, the seroclearance, and those who achieve an important decline in HBs antigen levels, that is, these partial responders, these patients don't achieve HBs antigen clearance. They relapse. So what is important is to achieve HBs antigen clearance. Now we have the results of the phase 3 study. This is the only phase 3 study in chronic hepatitis B. This is the study for the registration of this drug. It's a very easy and simple study. Patients with less than 3,000 HBs antigen levels were randomized to bepirovirsen plus a nucleoside analog or placebo. And you are going to see the results at EASL in Barcelona. So I invite you at EASL Barcelona to see the results that I am sure will allow the registration of this new drug. So in summary, we are now more than 50 compounds in development, mainly in phase 1 and in phase 2. And antisense oligonucleotide bepirovirsen has finished the phase 3 study. and probably will approve next year. This will change completely the treatment of hepatitis B. The majority of the drugs aiming for HBs antigen loss work in patients with low levels of HBs antigen. We need follow-up studies to see if the persistence of HBs antigen clearance with the new compounds it's persistent or not. Safety is a key challenge for novel therapies, and I think the future is combination, collaboration with different drugs, with different mechanisms of actions. Thank you very much for the invitation.